Hi, my name is Cece Williams. I'm doing my head-to-toe assessment on my patient Zoe. She's going to be my volunteer today. So first, what we would do is I'd come in, I'd wash my hands in front of the patient. She's here for a chief complaint, what she's here for, make sure she's AAO ×3, if her demeanor is proper for why she's in here, and I would have my MA take vitals, height, and weight. And then we would start with the head. So we're going to start by inspecting the skin, make sure there's no nodules, nodes, anything to any lesions, anything like that. And I would palpate the scalp, make sure that the hair is clean, no infestations present, and there's no nodules or nodes to be worried about. Then I go down to cranial nerves 5 and 7. So 5 would be the trigeminal. We would check your masseter into her mandibular joint. So I can open, close, and then go side to side. Okay? And then cranial nerve 7, which is, I already forgot. You're not supposed to talk to me. I get so nervous. Oh, yeah, so it's the facial nerve. So what I want you to do is put your cheeks out for me, smile, scrunch your, you don't have to keep your cheeks, scrunch your face up. Okay, so cranial nerve 7 is also intact. We would move on to then the eyes. So you can close your eyes, okay? Skin looks normal, and the eyelashes go up on the top and down on the bottom. And I would palpate for the lacrimal. You can open your eyes now. Lacrimal. There's no drainage that comes. The lacrimal apparatus and her conjunctiva look pink and moist. And then we would go to pupils. So we would do pupillary reaction. So I would test here, here, go back, and just look straight forward. Okay, so our pupils are equal, round, reacted to light and accommodation, curl up. And I would do the corneal light reflex next, so we would go upward. So you just look straight. The corneal light reflex, both eyes here. Okay. And then on the fundoscopic exam, I'm looking for the retina, the optic disc, and red reflex. So I'm going to just kind of look past my shoulder. Okay, and those are all visualized here. That's also visualized as well in both eyes. Everything looks normal, nothing to worry about. So we're going to move on to the ears. Yes. I'm going to assess, make sure that her pinna is in line with the outer canvas of her eyes, which they are. I'm going to inspect for any, on the pinna tragus, if there's any nodules present or any tenderness, which none's noted. I'm going to look in the ear canal, visualize the tympanic membrane, and this is the left side, so the cone would be at 7 o'clock, which looks good. And on the right side, the cone of light is going to be at 5 o'clock, which looked good to me. We'll move on to the nose. So we're going to look for symmetry on the nose, and then we're going to palpate the bridge and soft tissue. We're going to palpate the maxillary and ethmoid sinuses for no tenderness noted. Going to look through the up into the nose. Make sure nasal midline, no deviated septum, mucous membranes are moist. You could. Okay, and then we'll move on to the mouth. So, inspecting the lips. Can you just kind of like open your mouth, close your mouth, make sure your lips are moving symmetrically? Looks good. Lips are dry and pink, and there's no lesions or anything to be concerned about. You can open your mouth for me. We're going to look at the her teeth all look intact, no dental work. If you can see back your tongue for me, tongue goes midline. We're going to look on both both sides, make sure there's no oral cancers present. You can stick your tongue up. Everything lifted under the tongue. Nope, keep your tongue out. Buccal mucosa is pink and moist, and if you can go, now we're, now we're going to test your hypoglossal nerve. So what I want you to do, we would do a gag reflex. I don't have anything to give her for a gag reflex, but that is where I would test that now. And then, so for cranial nerves 9 and 10, and then I'm going to have you open your mouth, stick your tongue out, say ah. All right, and your so the uvula moves in its midline, and then comes back down after. Your tonsils look about a 1, so it's a normal range. Everything's good. And the hard palate is fused, and the soft palate is intact. So then we're going to move on to the neck. So I want to check the range of motion. So I want you to just move your neck side to side. Okay, up and down. Okay, and now I'm going to assess your lymph nodes on here. I'm going to check the submandibular, submental. I'm going to go down the anterior chain and the posterior chain, as well as occipital. There's no lymph nodes that are protruding, or any nodes that need to be of concern. I'm going to assess the carotid and JVD. I don't see any jugular vein distension from sitting up, and then I'm going to also palpate your carotid pulses bilaterally, one at a time. Okay, feels good, even rhythm and rate. And then I'm going to auscultate the carotid pulses with the bell. So what I want you to do is just, I just want you to hold your breath when I'm doing this just for a second. Not right now. Okay, and there I'm checking for bruits, and I don't see or hear any bruits. I'm going to check, make sure the trachea is midline, which it looks midline. I'm going to ask you to swallow while I check the thyroid. Okay, and I'm going to swallow. I'm going to check from the back as well. Swallow. Okay, thyroid feels good. No masses or anything I need to worry about there. We're going to move on now to the upper extremities. So we're going to go to your, make sure your shoulders and your scapula and your shoulders, scapula, and clavicle are all symmetrical. They look good to me. I'm going to palpate your acromion process in your joints, make sure there's no tenderness. Okay, and then we're going to test your range of motion for your shoulders and your elbows. So if your shoulders go like this, and you do completely around, okay, and no pain or tenderness, and then we're going to do your elbows. So it should go like this and like this. Okay, and no tenderness or pain. Okay, great. Okay, now what's next? Okay, now I'm going to check your deep tendon reflexes. So we're going to do your brachial, your triceps, and then your brachioradialis. So we'll do brachial on this side. So what I want you to do is just kind of, here, yeah. We'll have you relax your arm here. You see that? Okay, so we'll check this side as well. Alright, so for the triceps, I'm going to hold your arm out like this, and I want you to just rest your arm on me, okay? Tendon reflexes, let's see. There we go, I got one. There, okay, and then on this side, rest your arm on me. Ow! Sorry, did I get the wrong part? There we go, okay. And then we'll do the brachioradialis. So what I want you to do is put your arm out like this, kind of rest it on your leg. And then we're going to go kind of a couple centimeters up here. totally normal. Yeah. Got it. Ooh. Okay, then I'm going to check her brachial and radial pulses, make sure they're on both sides. All right, so brachial and radial pulses are 2+ bilaterally. And then I'm going to check, so we're going to check your arm strength. So if you can grip my hand or fingers, okay. Grip strength is good. I'm going to check your range of motion in your wrist. All right, and then we're going to do your capillary refill for all your fingers. So what I want to see is capillary refills brisk in less than 3 seconds in each finger. Okay, and now, so what I want you to do now is turn around and just kind of sit on the couch and let her stretch. Well, so she can see all the way up so you can see. No, like turn your back this way. Oh, your back this way.
Maybe on my knees.
Sure, that's fine. Okay. All right, so then we're going to move on to the back. Yeah, however you're comfortable. We're going to inspect the thorax. So what I want to see is the anterior, posterior, lateral diameters 1 to 2, which looks correct. Palpate and auscultate the lungs. So you're going to tenderness here. Yes, no, yes, no. Keep going. Okay. So then I'm going to auscultate the lung sounds. Right, so I just want you to breathe normal, okay? Deep breath. Deep breath. Deep breath. Deep breath. So lung sounds are clear, bilaterally, anterior, or posterior and lateral. We're going to do tactile and vocal fermentus now. So what I want you to say is 99, like 6 times. So we're going to say 99, you say, we're going to feel it, say 99. Okay. Okay. Okay, so, and then I want you to, and you're going to say it again. So So tactile and vocal fermentus, it lessens as I go down, and it is muffled on my stethoscope, which is what I want to do. And now I'm going to check lung expansion, make sure it's even bilateral. So what I want you to do is take a deep breath in and out. All right, lung expansion looks good. Okay, now you can turn back around. We're going to go. Now we're going to move on to the chest and the heart. So I would inspect the skin again. I'm not going to make you take your shirt off. So I would inspect the skin, make sure it's even with the rest of the body, and there's no nodes or lesions or any moles that I want to be worried about. So just we would I want to find the point of maximal impulse, which would be the apical pulse that I would find left to lateral mid-clavicular line right around the 5th intercostal space. And I'll palpate that when she's laying down. I'm going to auscultate APETM or aorta, pulmonary, Erb's point, triciped, and mitral valve. I'm going to do that twice. I'm going to do that while she's sitting up, and then I'm going to do it again while she's laying down. So you just breathe normal. We'll do the 5 points now. at the apex, and S2 is louder at the base. I don't hear any murmurs present, and then I'm going to have you lay down. Let's see. I can have you just kind of lay. Yeah, that works. Just for sake of the assessment. I'm going to listen again, laying down. Just see. Okay, once again, S1 and S2 are how they're supposed to be. I have no murmurs present, and so now I would palpate the apical pulse. Once again, fifth intercostal space, point of maximal impulse, so palpate that. Okay, so feels good. And now what I'm going to do is we'll have you just come up here for the abdomen. Okay, so I'd inspect the skin for the abdominal exam. Make sure her abdomen is round, flat. It's even bilateral on both sides. There's no, protrusions or anything that I need to be worried about. So first, I want to auscultate the 4 quadrants of the bowel. Make sure that bowel sounds are present in all 4 quadrants. That she's not hyperactive or hypoactive. Start here. Especially since you just had Cheetos. Okay, bowel sounds are present in all 4 quadrants. Then I'm going to start with light palpation and then medium palpation on the 4 quadrants. Going to palpate, just let me know if there's any tenderness that you're feeling. Okay, then we're going to go back around to medium. Okay, everything feels soft, there's no tenderness. I don't see any, well, I haven't tried it, but hopefully there's no rebound tenderness. Now I'm going to palpate and percuss the liver and the spleen. So I'm going to palpate first, liver and spleen. And I'm going to percuss. I'm going to palpate McBurney's point, which could indicate appendicitis if she has tenderness. I'm going to check for any rebound tenderness. Can I let up? Any tenderness or let up? Okay. Which could indicate peritonitis. Any type of tenderness during the liver examination would have it would have implied maybe inflammation of some sort. I need to shoot. So I'm supposed to auscultate the valves as the aorta, iliac arteries, and femoral arteries. I listen about here. But I got you all. I was supposed to do that before I palpated. Because now you're kind of like all bubbly. Okay. Was a little muffled since I palpated before I listened, so probably not a proper diagnosis on that, but I didn't hear any bruise. Okay. We can put your shirt back in. And we're going to move on, if you want to sit back up. We'll move on to the lower extremities. So I would palpate and check your knees for range of motion, so you can come up and down. No crepitus or anything like that, no tenderness. Up and down. All right, no crepitus, tenderness noted. We're going to check your knee deep tendon reflexes. I'm forgetting. Do you think you're off the thing, or do you maybe want to sit up here? Let me get you. so deep tendon reflexes for the knee. We want perfect. Yay! Deep tendon reflexes are good. Let me see. Want to do your feet and ankles as well. Palpate shin, feet, ankles. Check these deep tendon reflexes since we're already up here. Can't really see. Let's move that down a little bit so she can see. Okay. I'm gonna just do the Achilles. We'll do the plantar when we'll have her lay down again. But Achilles will be over here. So I'm actually gonna pull your foot up like this, and I want you to kind of, yeah. Okay. Yeah. Just like that. Okay. Perfect. Okay. So then we're going to move on from that to, I'm going to test your hips. So I want to kind of palpate your hips, make sure there's nothing anteriorly that's tender or sore. And we want to test your hip range of motion. So are you able to, I would say maybe lift your legs up like this? Oh, okay. Yeah. All right, proper range of motion is good in the hips. And then we're going to do, we'll have you stand up, make sure that we're in the, I think we'll do your spine, and then we'll do your neurological exam. So what I want you to do is have you stand like this. So I'll have you kind of, just kind of bend down a little bit, hands at your side. So what I'm going to do is I'm going to inspect the spine, make sure the skin is good, that there's nothing, it's the same as the rest of the body. There's no nodules or nodes or any type of lesions to be worried about. I would palpate the spine as well as the paravertebral muscles. No tenderness or any type of abnormalities that I need to make note of. Spine is midline, and have you, so arms at your sides and then arms dangling too. Make sure that's still spine at midline, okay? Everything looks good, feels good. All right, you can see that. And then we're going to do neurological. So what I want you to do is just kind of heel to toe walk just to my table there. All right. Okay, perfect. And then come back. Try and up. All right. Looks good. Heel to toe test is great. Can you touch your toes? Perfect. And then can you bend side to side? That's spinal range of motion that we're checking right now. Perfect. Okay. Let's see. We would ultimately check the exteroception and proprioception as well. I don't have tools. I guess we would do for exteroception. I would have her close her eyes, and I would, kind of poke and see if that feels sharp or soft. I do that on maybe like her arm on both sides bilaterally, and then for proprioception, I would, for example, just show her like this is me moving your finger up, and this is me moving your finger down. I'd have you close your eyes, and you would tell me which way I'm going. So, down, up. Okay. So that's just an example of proprioception. I realized that I forgot to do spinal accessory for cranial nerve 11, so I'll actually test that now. So what I want you to do is shrug your shoulders against me, against my arms. Okay, perfect. And then I want you to push against my hand, both sides. Okay, again. Okay, perfect. All right, so that was checking spinal accessory. Anything else that I can think of that I may have forgotten? We would check a Romberg test. So what I want you to do is hold your arms out like this. And then I want you to, I'll stand on this so you can see me. I'll catch you just in case, which I don't think you're gonna fall, but I just want you to close your eyes for a few seconds. Okay, so it's a good Romberg test. So that was it. so I guess a positive would be if you lose your balance or something like that. It's a sign of neurological deficiency. We'll check your plantar reflexes. So I'll have you lay down again for the last time. And I'm just going to kind of like swipe this along your foot, and what I want your feet, ideally your toes would curl in, if that makes sense. So we check your plantar reflexes like this. I know it's a little strange. Okay, and then it's not okay, so we check plantar reflexes. I think that that's about all that I can remember with these head to toe. So I think that we are finished with your head to toe exam. Yay! Thank you.